Hi, my name is Sherry Gainey, along with group members Paula Soto Brashada and Darnell Davis. We will be talking about COVID-19 vaccination among middle school age boys and girls. Let's first start with some background information. In 2020, the world experienced a global pandemic. There was a vast number of illnesses and deaths due to a highly contagious disease named the coronavirus, later referred to as COVID-19. The World Health Organization and the Center for Disease Control initiated a campaign for the world's population to become vaccinated in hopes of decreasing or minimizing the disease transmission while also reducing the death rates around the world. The ultimate goal was to achieve herd immunity within the populations. National and international levels learned through the data collected and research conducted by the World Health Organization and the Center for Disease Control that one major problem preventing lower death rates was due to the African American communities. The African American community was experiencing a greater loss of life to this disease, possibly as a result of vaccination hesitancy. Vaccine hesitancy refers to a delay in acceptance or refusal of vaccination despite the availability of the vaccination services. Now, this hesitancy could possibly have derived from past experiences that failed the African American community, such as the Tuskegee Airmen experiment. Understanding hesitancy among adolescents is important, not just because of the protection vaccination provides, but also because the attitudes of children may influence their peers and even their parents. The Center for Disease Control has presented information that there's concerns have led to lower vaccination rates among African American middle school students, both boys and girls aged 11 to 13. Now, 55% of the adolescents in that age group have received at least one dose of the COVID-19 vaccine in Florida. And of that number, African American adolescents in the same age group for North Florida and Duval County represent only 15% of the vaccinated individuals. A needs assessment conducted by the local level Florida Department of Health helped determine the social diagnosis and the need for a program promotion in the area of North Florida and Duval County. It was deemed to be an essential way to help promote vaccines for middle school adolescents who lack medical reserve groups to visit their school settings and to offer COVID-19 vaccines. Now, stakeholder Roger Doltz, the health quality improvement specialist for this organization, was interviewed and confirmed the need for implementing a program in that area. Mr. Doltz was willing to accept our offer to work alongside the Florida Department of Health, and he was also very interested in our goal to implement a useful health program to promote the adoption of vaccination against COVID-19 among the African American community, and to educate our middle school students on the importance of vaccination so that their social significant behaviors may aid in preserving future generations. One proposed solution is to implement the Leveling Obstructive Vaccination Program, also known as the LOVE program. Now, the LOVE program aims to promote health behaviors among adolescents and their parents. It will focus on and possibly reduce vaccine hesitancy among the vulnerable population. It will promote increased vaccination uptake in school settings, and it will also enhance the accuracy of vaccine tracking by the Florida Department of Health among the vulnerable population. Through this program, we hope to aid adolescents and their parents in acquiring practical health knowledge. We're working towards helping to increase their belief and attitude towards adopting healthy behaviors and that they can utilize throughout their lifetime. Now, we strongly believe this solution will be effective because the Love COVID program will incorporate peer-to-peer promotion and believes this type of promotion can adequately advocate and educate adolescents regarding COVID-19, its safety, and the effectiveness of immunization. The program is a way to help reduce the at-risk community's concerns while possibly increasing vaccine acceptance through shared knowledge. As we seek to understand the cause of this public health problem, we intend to use a practical based evidence approach, such as clinical expertise from the Florida Department of Health, to help identify and implement solutions obtained in the real world. We plan to form a partnership with this agency as a way of helping to identify solutions that work to promote better health and trust among our community. Next, we will have Paula discussing our program description.
Thank you. This image only shows that vaccine hesitancy was already a threat to global health in 2019, according to the World Health Organization. So the Leveling Obstructive Vaccination Effort, LOVE, it's a newly developed program designed to educate adolescents and parents on the importance of the COVID-19 vaccine. We use proceed theoretical framework to plan our program. Based on the evidence and research we found, we thought the best theory to use LOVE was health belief model, as it has been used before to change vaccination behavior. In addition, Hida et al. States that health belief model may be employed in the context of a public and ongoing global pandemic. The constructs, cue to action, and perceived barriers are the ones that we're gonna use to target with our activities and education program. The LOVE program aims to reduce vaccine hesitancy among vulnerable populations and increase vaccine uptake in the school settings. Our program will provide culturally appropriate services for the acclimated target population of African American adolescents in middle school and reduce vaccine hesitancy among this population. The LOVE program is a school-based health education program that will be integrated into middle schools through Jacksonville, Florida. This program will be critical in reducing adolescent health risks by delivering efficacious health education regarding COVID-19 vaccines. To implement our program, we will be using resources from the Center of Disease Control and Prevention, the CDC, and the American Academy of Pediatrics that were created specifically for the ages of our target population. All these resources can be found in both institutions' websites and are of public use. With these resources, the health educators and leaders of this program will design a half-hour session about the importance of the COVID-19 vaccine, the benefits, the risk, and the myths and the safety of these vaccinations. These sessions will include printed information, and these are resources that are already in the CDC and AAP websites and are for public use. These half-hour sessions will be held in the 16 schools with lower vaccination rate and higher vaccine hesitancy rates among the 61 middle schools that exist in Jacksonville. We will determine these in our pre-test evaluation. We will conduct a survey of vaccine hesitation that's a reliable and valid instrument found in the assessment of vaccine hesitancy to a COVID-19 vaccine in Cameroonian adults that was conducted in 2020. And other of our activities will be the COVID vaccine clinics. These will be held once a month, expecting the students and parents enroll in the 4 schools that the half-hour sessions were given before to attend. In order to motivate people to show to these vaccine clinics, besides having the workshops, we will have fun activities, attractions, and prizes. Our program will last from October to April with all the implementation of it. But we will be holding the school sessions from mid-November to mid-February, and we will start the vaccine clinics from mid-December to mid-March. For our program, we will be needing a project manager, health educators, nurses that will be provided by the Florida Department of Health, and volunteers. To achieve our objective, we will plan educational sessions promoting the benefits of getting the COVID-19 vaccine. We will facilitate access to vaccine administration places, and we will create workshops with truthful evidence-based information. These are examples of the resources that we can find at the CDC page and the AAP websites. Evaluation plan. We will assess vaccine hesitancy, vaccination rate, and COVID-19 knowledge, conducting an impact evaluation and pre-test, post-test. We will be evaluating the vaccine hesitancy the same way or with the same survey I mentioned before. The data collection plan of the LOVE program comprises a two-step process to retrieve all viable data. The first step of the data collection plan consists of utilizing the data exchange program provided by Florida SHOTS. Immunizing providers can instantly report and manage immunization data through the Florida SHOT program. A project team member will meet with the Florida SHOTS database manager at the Florida Department of Health in Duval County to obtain the immunization records and spreadsheets of the targeted population. Now I will leave Darnell to talk about our program budget.
Thank you. The budget that you see here is a condensed version consisting of 3 categories. I will go into the details of each category. The first being the total cost for personnel. Total cost for personnel is $7,068.87. So for the personnel, we decided to choose 4 nurses to help with the amount of traffic that we will receive every hour during our vaccination event. We decided to use an hourly rate of $50.40 to pay our nurses, which was based on the average salary of nurse practitioners in Florida. And that was found on the US Bureau of Labor Statistics website. We also felt that we should only hire 1 doctor to teach the vaccination class once a month. We felt that the average salary was appropriate to pay that doctor, and we based the salary off of the average salary for physicians in Florida, which was $113.43 an hour, also from the same US Bureau of Labor Statistics website. The volunteers themselves will not get paid since they will only be needed to facilitate the activities during a field day as well as the workshops. The next category is the total cost of the facilities, equipment, and supplies. So our program will be using different schools throughout Duval County and Jacksonville, Florida. We decided that an auditorium would be most appropriate for teaching the classes because there would be a potential for many people to attend, especially since it's only once a month. An auditorium would also be effective as a place to administer the vaccine and hold people for 15 minutes once they receive the vaccine, just to ensure that they did not have any adverse side effects. So we were decided in the budget to spend $900 for the auditorium to use as a class, as well as $900 to use the auditorium for the vaccination event for the 6 months. And these fees were taken off the Duval County Public Schools website facility forms page. Now, in regards to the vaccine will not cost anything since it is free to the public. But we did add into this facilities, equipment, and supplies budget, we added pens, clipboards, and copies so that the attendees would be able to fill out the necessary forms. We also added tablets into this part of the budget as well, because we felt it was necessary for the nurses to use to record the data from each vaccination event and report it to the CDC. The third and final category that I will go into detail is the total miscellaneous cost for personnel. So we felt that the materials for the field day activities were estimated to be $1,000. And then we also determined the food budget for our staff by taking 10% of the rest of the budget and applying it to the food costs. So for the last two categories, we have the budget being 21,000 for total facilities, equipment, and supplies, and $3,906.89 for the total miscellaneous cost for personnel, making our total budget $31,975.76. And since you, the Florida Department of Health, would be financing this budget, we would be using your doctors and nurses to administer the vaccine and teach the classes. So moving on to our logic model, we will use our logic model to help guide us during the length of the program. The LOVE program is set to last 6 months during flu season, but the hope is that the effects of the program will last beyond that. The short-term goals of the program are to reduce the rate of adolescents who missed vaccine doses, reduce vaccine hesitancy among African-American adolescents ages 11 to 13, and increase vaccination rates of African-American adolescents who attend the schools we visit during the program. Our long-term goals are to enhance health barriers of adolescents, decrease the rate of vaccine hesitancy throughout African Americans in North Florida, improve the rate of vaccinations, clinics, and workshops, and increase the rates of vaccinations of African American adolescents in North Florida. We felt that these goals were appropriate for the program because African Americans were hesitant or fearful of getting the COVID-19 vaccine. Their fear would inhibit their children from getting the vaccine as well. Bogart et al. Stated that 64% of African Americans thought the vaccine was harmful, and that 62% of African Americans thought that their race group was treated differently by people within the healthcare system. Now, the 11 to 13 age group could also be approved regarding vaccination rates in Florida, along with the vaccine hesitancy rates. According to the CDC, 31% of children ages 12 to 13 in Florida have received at least one dose of the COVID-19 vaccine. This is below the national average of 36%, as stated by Murthy 2021. The inputs as shown on our logic model will be the catalyst for our program to reach its goals, but I will go into more detail on the next slide on what has to be done to ensure success. Our program will spend a month training the staff and volunteers to make sure they are prepared. Our staff needs to be well-versed on the COVID-19 vaccine and be able to answer any questions the public may have. They must also be effective and licensed to administer the vaccine to ensure that it is done properly. Our volunteers need to be creative and engaging when running the workshops and games during the vaccination events. This is actually very important because this will attract people who may not have shown up if it was only just a vaccination event. To combat vaccine hesitancy, we must hire African American health professionals. According to Bajaj and Stanford, African Americans go out of their way to be seen by a physician of the same race. So it'd be pertinent to hire African Americans so that they feel comfortable attending the workshops and getting the vaccine for themselves and their children. The classroom curriculum is also very important. Even though we will be teaching inside the classroom one school a week, we will need to fully educate the students as well as get them excited about getting the vaccine so that they and their parents will attend the vaccination events. The financial aspect of the program is, of course, very important to the success of this program. Obviously, an effective budget will ensure that all staff will be paid on time, and paid what they are promised, and that there will be no delays in the program. As program leaders, we must ensure that we stick very close to the budget. Lastly, we must continue to have clear communication with you, our stakeholders, so that we can keep you all updated on the progress of our program. We're going to keep you aware of when the program reaches its goals and how we're sticking to the budget every step of the way. And that will allow you to have us lead this program to success. So I want to thank you for taking the time listening to our presentation or our proposed program plan. Hopefully you will approve. Thank you so much. Here are our references.